Good morning to the Facebook Live community. It's a great privilege for me to be here this morning to share with you. I'm Kevin Yingling, the current CEO of Mountain Health Network, and I'd like to just share with you for a few minutes about myself, about this important organization, Mountain Health, and maybe just take you back a ways. I'm a Huntington person. I graduated from a local high school. To date myself, I graduated from Barboursville High School, and this was our community. This was my family's community and my community, and we were very encouraged to be part of this community. I realized that I wanted to make a difference for others, and that led me to a career initially in pharmacy, and I thought I could make a difference in people's lives because I grew up in a community pharmacy in Barboursville, and I saw that pharmacist impact on people's lives, and that was a great role model for me. And as I moved through pharmacy, I began to realize that perhaps I wanted to do more in the healthcare environment, and decided to move on to medical school. And for my medical school training, I decided to return to Huntington because it was home, and I felt that this was the right community for me to study hard, work hard, and achieve the accomplishments of receiving my medical degree. From there, my wife and I, who's a West Virginia native, moved to Cincinnati, and there for 5 years I continued my training. I was the chief medical resident there at the University of Cincinnati and went on to do a fellowship year. And about that time, to tell you the truth, my wife used to wear this sweatshirt. It was a picture of Dorothy from The Wizard of Oz with the red ruby slippers, and it said, "There's no place like home." And she would wear that sometimes when I came home from a long call at the hospital, and I realized that it was best for my wife, my family, and myself to return back to Huntington and start a career here in Huntington. I came back to Huntington really thinking that I would make a difference through medical education, and my initial career was in medical education, teaching residents and medical students and taking care of patients to try to make a difference in that way. After a career in academic medicine, moving all the way through being the chair of the Department of Internal Medicine, my interests changed, and as you know, the university decided to start a pharmacy school, so they asked if there was someone who might want to lead the founding of a pharmacy school, and because of my background in pharmacy and my connection to this community, I felt that was the next part of my professional journey. And after 7 years there, I thought I should return back to medicine as my primary focus. And about that time, I was asked to serve on the board of the board of directors for Cabell Huntington Hospital. And it happened to be at that time that the acquisition of St. Mary's Medical Center had really come to its nearing its conclusion, and it was a great privilege to be part of that team that helped to make that happen. And soon after that, I thought maybe it was time to do some other part of my life journey, and maybe I would be attracted to something else. But really, through a lot of discernment, personal discernment, professional discernment, I really felt led that this opportunity was the right opportunity, that I really, in a confident, humble way, I felt that I could again try to make a difference for others through serving as the CEO for the Mountain Health Network. The Mountain Health Network has matured a lot in the last 3 years of its existence. We are evolving, changing, moving, growing, and it's very exciting to be part of that. I might just share with you a little bit about Mountain Health Network and what it actually means, what are the, if you will, the moving parts of that, because it's very exciting to be able to serve as the leader of this growing organization. So as you probably know, the two key anchors of our hospital system are St. Mary's Medical Center and Cabell Huntington Hospital. Maybe just as a personal note, I started working at St. Mary's Medical Center in 1978, and I experienced my first employment at Cabell Huntington Hospital in 1979. Now, you would reflect on that, hopefully, that I look too young to be working at the hospital in 1978, but as a very young child, I started my career there as a pharmacy technician, and I have family that have worked in both hospitals over those years. I have a real connection to both hospitals. But back to the point about our network, Those are the two key institutions for the Mountain Health Network. We also have a very positive relationship with Pleasant Valley Hospital, which we're growing and maturing month to month, and that will certainly be part of our system dynamics. And we look forward to growth across the region. We are a leader in healthcare for our communities. I must say that we are uniquely situated in Central Appalachia. We are the leaders in healthcare in Central Appalachia. We know the people that we serve. You know, we are very well equipped to provide acute, life-saving care to patients who need that in our hospitals. We're very well equipped to provide hospital-based care for those we serve. We are very well equipped to provide ambulatory care across a wide platform in our communities of this region. And we are well prepared to provide value-based care, if you will, the next part of the network development. You've probably heard of accountable care organizations and value-based care. We are well prepared to be in that environment as well. So it's an exciting time to be in healthcare. Yes, we are clearly attentive to the COVID infection concerns. We are clearly involved in the surge of COVID at this time. But that does not deter us from continuing to move forward on the mission that we have set before us. I mean, we are prepared to provide advanced medicine and compassionate care to every individual who enters our healthcare system, whether it be through an accountable care organization, through an ambulatory care clinic, through the hospital emergency room. We look forward to serving our community. I might just share with you some accomplishments. I'm gonna look to make sure that I kind of get them accurately so that I can share them with you. Over the past year, we've certainly been very encouraged by the Pediatric Center of Excellence. You know, we've had the opportunity to recruit many pediatric specialists to this community: nephrologists, infectious disease, neonatologists, child life development, behavioral therapists, all important components of a growing healthcare system meeting the needs of our pediatric population. We now have a pediatric medicine fellowship, and starting next year we'll have a neonatology fellowship program, training physicians to become the next generation of neonatologists. And probably the most exciting thing in the last several months has been, through West Virginia University, we are now part of the Children's Miracle Network. And that is just a fantastic opportunity for individuals interested in gifting to our Hoops Hospital, or Hoops Children's Hospital, now through the Children's Miracle Network. You can be confident that your contributions through that network will arrive here at the Hoops Pediatric Hospital and will make a difference for patients in our community. We are very excited about that. When you're out shopping at your favorite store and you see the solicitation for the Children's Miracle Network, when you decide to make a contribution to that, you can be confident that part of that will come right back here to Huntington and make a difference for the care of children in our communities, and it's a great opportunity. I'd carry forward by talking about the Cardiovascular Center of Excellence. That obviously is focused at St. Mary's Medical Center. St. Mary's has a long, rich history of providing advanced care in cardiac disease for the citizens of our community. And today, there are ever-changing and ever-evolving technologies that are important in the care of patients with cardiac disease. I was very encouraged recently to hear about a new program there, which is kind of shock wave intravascular lithotripsy. Now, many of you all would recognize lithotripsy because we've had that for years, the idea that somebody has a kidney stone and they use shock waves through the body to bust up the calcium stone so that the stone is smaller pieces and it'll go through the urinary tract without much pain or discomfort after that's been done. Just think now we have technologies that when you have a coronary artery that's partially obstructed or obstructed, they can use sound waves to break up the calcium in the wall of the artery and be able to pass, let's say, a wire or a catheter or a stent to improve flow in that artery, improve the outcome of the patient. That's just one of the advanced technologies that are available through the Cardiovascular Center of Excellence at St. Mary's Medical Center, and we were very encouraged about the growth and the expansion of our services in cardiology. One of the things I think is really important for any patient when they enter a hospital system is what's the level of quality, what's the level of safety in that hospital? You know, we make safety an important priority for the patients that come into our care in the hospital setting. I would just like to share with you that in the past year there's been reductions, significant reductions in serious concerns about safety. Areas such as if a catheter is inside the body to administer medicines or to draw blood, there can be a catheter-associated infection. We've decreased the infection rates around the use of those important catheters. We've decreased the concerns about this methicillin-resistant staph infections and that they get into the blood through various mechanisms while you're in the hospital. We've reduced the rate of those infections. And another important area that I'm sure is attentive to, would be an attentive issue for any patient, is the site infections that may come around the time of an infection. So I go in to have a surgery, want to make sure that that incision remains clean and heals well. We've reduced the incidence of infections around those types of surgeries. That's a sign of a system that really is attentive to the safety of the patients that come into their care. I might just emphasize a few other things that, you know, in the midst of COVID and all those challenges, we have continued to meet the needs of our patients within our hospitals. We've expanded floor spaces into new areas, creating more areas for emergency department patients to be evaluated and cared for. We've expanded the services around endoscopy. So when it's the right time for you to come and have an endoscopic procedure, when you understand it's safe and the environment is safe, we have expanded the opportunities for you to have endoscopies in our hospitals. Another thing that's really important and quite a challenge in COVID surge times is bed availability. Who has the bed, which floor is the bed on, what kind of bed is that? There's now an electronic system in both hospitals that allows us to track the bed situation. Now, you would recognize that as my loved one is in the emergency room and needs to be admitted, and what bed are they going into? Having a system that allows us to track the beds and efficiently and effectively get the patient in the right bed at the right time, that's a huge improvement to our system, and we're very encouraged about that. There's other building projects that have occurred in the past year. We've expanded our regional sleep center at St. Mary's Medical Center for the entire system. We have expanded retail pharmacy across our system, looking at retail pharmacies at both HIMG at St. Mary's Medical Center and the 3 pharmacies that are part of the Marshall Pharmacy system. I got to make a comment just for a second on that. You know, the Marshall Pharmacy is the only pharmacy that's 24/7 in our community. When I was growing up, we, as part of pharmacy, we kind of knew which pharmacies were open late, where patients could get their medicines filled. But you have the opportunity that if your loved one or you yourself are ill and your physician has called in a medicine, or you get a prescription through the emergency room, you can get that prescription filled any day, any time, day or night. It's an incredible service to our community, and you know, just going back to my roots, that's where I felt pharmacy really made a difference, is impacting on people's lives like that. We are growing other aspects. You know, because of COVID, we've expanded into telehealth. We have an enormous telehealth mechanism in place. Looking forward to providing telehealth going forward. That's an interesting and dynamic area. Obviously some types of illnesses and some patient populations, telehealth is very useful. I know for myself during COVID times, the ability to call my patients who did not want to leave their home, had every reason not to leave their home. It was very important that I was able to touch them, see them, impact on their care through telehealth. We look forward to expanding those. Maybe highlight another aspect of a network dynamic that's important. This goes back to the origin of our healthcare system, and that's to have a communication platform, an electronic health record that can be shared by all the physicians and all the providers in our community. So we have a system called Cerner by name, and Cerner allows us to have an electronic platform that when I practice in my office, I can look up information, laboratory tests, x-rays, I can communicate with other healthcare providers, I can facilitate the arrangement of their appointments. That is really important in a healthcare system that needs to be highly reliable to provide excellent care to our patients. A few other accomplishments I'd like to just touch on. I do not need to highlight to you that our community has been significantly impacted by the opioid crisis and the opioid addiction challenges. Prior to coming to this position, I had the privilege of serving as a provider at our local center called ProAct. You talk about being able to make a difference for a patient population. There's been few experiences that have exceeded what I felt I was able to provide to a population in need than when I served at ProAct. Few times in my career have I felt so clearly frontline being able to impact there. But the reason I bring that up is I want to make sure that you understand that we, Mountain Health, understand our commitment to addressing the needs of that particular community and their families. And in a variety of ways we continue to do that. Our support of ProAct, our continuing support of other county initiatives. I need not tell you about the quick response teams and other aspects of the care that is provided for patients that are in addiction. Being able to provide naloxone in a timely manner for those patients. These are key components of a community-based system with a health network that's ready and willing to commit to that. So we're very encouraged about our ability to continue to commit to that. I am hopeful, as you are, that this particular crisis will begin to wane and that we will begin to see a day in which that community has turned from their addictions, come into long-term recovery, and again are a productive member of our society. Probably a few more future growth things. I'd like to, very excited about the opportunities that we're building new facilities. Again, in COVID times when things seem locked down, the system continues to look forward to providing additional services to our community. So we're about to have a groundbreaking for a new medical office building on the campus of Cabell Huntington Hospital in cooperation with our leading partner in healthcare, Marshall Health. That will be a $51 million investment. It'll be a 75,000 square foot building. We will be able to expand services in physical therapy, neurology services, physician offices, and most notably endoscopy. The ability to provide advanced gastrointestinal procedures and services to our community has been a goal both of Cabell Huntington Hospital, St. Mary's Medical Center, and now the network for years. And we are on the threshold of really making a big difference in that area. So I look forward to seeing the technologies that will be brought to that area and the growth that will occur by attracting patients to a legitimate digestive disease center unified across our network. That's an exciting area to think about for the future. We're constantly trying to engage and invest in opportunities for growth of our system. And that's really so important when it comes to looking at the mosaic pattern that makes up Mountain Health. The mosaic pattern that makes up Mountain Health, HIMG, St. Mary's Medical Center, Three Gables Surgery Center, the surgical center close to Cabell Huntington Hospital, two hospitals, St. Mary's, Cabell Huntington Hospital, and the Edwards Comprehensive Cancer Center. These are all, if you will, jewels in the crown, but none more important than our relationship with the School of Medicine and Marshall Health. That is an important strategic partnership that's really important. It's been important to the growth of our community. It's important to the growth of our healthcare system, and I look forward to many shared opportunities for growth with Marshall Health, and that'll be very exciting. I think I've probably covered a pretty broad sweep of our community and our healthcare. I could carry on a little bit further, but I really would want to emphasize that we are uniquely located in central Appalachia ready to provide care for 1 million patients across this region, one of which is you, your family, your friends. We're ready to serve when you need us, and I look forward to the exciting challenges that come with this opportunity. I'd be open to any questions you all might have.
Let's start with COVID. Can you tell us a little bit about our COVID response and what you would urge people to do to protect themselves?
Sure. So the COVID surge that we're currently in is real. It is halting in its rate of growth. The number of patients that have across the state of West Virginia that are going into hospitals because of this COVID surge related to the Delta variant. It is a constant attention within our healthcare system. We have a very effective command control structure that meets multiple times a day to allocate resources to address this. I would say that as difficult as the numbers are, comparing the surge earlier this year to the current surge, we are already 2/3, pushing 3/4 of the surge that we had earlier. We are on a trajectory of real concern regarding patients being sick from this disease. And I would also say, just as you all have heard probably from media and other sources, there is a shift in the patient population that are currently affected by COVID, the Delta variant. I can explain that more clearly by the first surge in our hospital system. We saw more patients being hospitalized at St. Mary's Medical Center and less patients in terms of volume being admitted to Cabell Huntington Hospital. It's already known that St. Mary's Medical Center, because of, let's say, the Center of Excellence in Cardiovascular Disease, has a patient population that tends to be older. Cabell Huntington Hospital, that patient population tends to be younger, certainly because of pediatrics focus and our focus in maternal and fetal medicine, a younger population. Last time, maybe the first surge or the winter surge, predominantly St. Mary's, less so Cabell. This time, predominantly Cabell, less so St. Mary's. Why do I bring that up? Because this variant and its infectivity rates are clearly capturing those that are unvaccinated, because more of the senior citizens vaccinated through the early part of 2021, and capturing a younger population in terms of its illness. And the outcome is serious. These patients are ending up in the hospital. So we're in the midst of attempting to address that internally. I would say this is a good time to think about theory and reality. Theory and reality. The theory was, when COVID first started, that it could affect millions and millions and millions of patients around the globe, including here in West Virginia and Huntington. Reality, it infected millions and millions of people around the world, including people in West Virginia and Huntington. Theory, it was a deadly virus. It could cause serious illness and death. Reality, it caused serious illness and death. The second surge, the Delta variant, theory, it's likely to affect a younger population than the first variant. Reality, it does affect a younger population. Theory, the vaccination will protect you from serious disease and death. Reality, the vaccine protects you from serious disease and death. The vaccine is effective. The vaccine makes a difference. I encourage everyone to thoughtfully compare theory and reality and understand that vaccinating is really important. Theory, masks decrease the prevalence of the disease being spread within a community. Reality, masks decrease the prevalence of disease being spread in the community. Now, if you don't hold to the theory that it decreases COVID spread in the community, allow me just to amplify that during this past year, for the first time in my entire career, we had almost no influenza virus activity in our community. Every year prior to this, my time as a primary care provider, hospital-based physicians, ICU physicians, always knew that when it came to the winter months, we would have an uptick in influenza virus activity. People would get the flu, people would be sick, people would be, if you will, harmed by that virus. And it happened every year except last year. Why? Theory, reality. If you wear a mask, it prevents you from transmitting a virus. Reality, we had no influenza virus last year. We had very little. We had numbers of like 1, 4, 5, not hundreds and thousands. So theory, reality. Masks make a difference. Wear them. If you're in a closed space setting, you're close to people, wear a mask. You're outside, enjoy yourself. Vaccines make a difference. Think about it. Consider it. Now's the time to really consider taking a vaccine to protect your own health and the health of your family. I appreciate the opportunity to comment about COVID infections.
Absolutely. We had, one of the callers has asked about future cancer center plans, the 2 separate, particularly over at HIMG, we have St. Mary's, and of course we have the Edwards. Can you comment about future plans for the Oncology Center?
Sure. So the question has to do with oncology services across our community. And first let me recognize that we really have been a blessed community in the last several years for having 2 excellent site locations for oncology services. I think it's, since I'm speaking to the HIMG Facebook audience, I would like to say that I have a great deal of respect, admiration for the services provided by Dr. Garrett Kimmy over many, many years. I remember when Dr. Kimmy came to this community, and I was a young physician in this community, and very few people have been more committed, more dedicated, more hardworking, and made a bigger difference in oncology than Dr. Kimmy has during his career. And if it's the time for him to retire and move forward, then we would wish him the best in his retirement and appreciate him for everything he's done here. But that's my way of recognizing that St. Mary's Medical Center and the Huntington Internal Medicine Group have always had a clear focus and a lot of activity in the field of oncology. And at the Mountain Health level, we respect that, understand that, and appreciate that. As well, we can appreciate the efforts that started with the Edwards gifting of the Edwards Comprehensive Cancer Center and the growth of that center. And the growth of that center has also made a huge impact on our community, providing services and the breadth of services that we've not had before. I would just add to the benefits of the Edwards Comprehensive Cancer Center that a decision was made several years ago that there needed to be more oncologists in America. We needed more hematology oncology physicians in America. And it was with a great deal of satisfaction that through the Department of Oncology at the Edwards Comprehensive Cancer Center that we now have a fellowship in hematology oncology, and those graduates some of them have decided to stay and make a contribution across our region in improving oncology services. Having said that, of course, Mountain Health has an interest in how do we unify these 2 excellent organizations into one effort to meet the needs of our community. First of all, I must say that the footprint of both of those centers is about equal. So Mountain Health does not look at one as being larger, more unique. We look at them as being very comparable in terms of their footprint, their market share, the services that they provide. We see the opportunity from the Mountain Health perspective to be able to unify this and expand the services across our region. What that looks like in the next few months and years, I can't project to you today. I would say that, for instance, there's some great opportunities, some of which have already begun to be unified. For instance, it should be the standard that any patient who has a malignant disease, is afflicted by a cancer, during their care has an opportunity to participate in a clinical trial. Clinical trials aren't for every patient, but it should be an opportunity that is offered to every patient. And it's important because you're expanding the discovery and the treatment of very serious diseases if we did not have clinical trials, we wouldn't have the new treatments that we have today, the advanced treatments we have today, particularly in immunobiologic treatments for our patients. So patients had to participate in those clinical trials in order to generate the information and the evidence that allows a drug to be approved and come to market and make a difference in a person's life. Understanding that argument, having a clinical trials program across Mountain Health is really important. We would like to provide that service so patients don't have to leave our community. And just this past week, a decision was made to unify the clinical trials program across the entire Mountain Health platform so that oncologists, wherever they practice within the network, will be able to have access to trials. These are trials that are not just principal investigator trials from our local community. These are national trials. These are pharmaceutical company trials. These are trials that come from any center in the country, prominent tertiary referral centers, in which our patients can participate in them right here in Huntington and not have to travel to do that. So I see a lot of opportunities like that where Mountain Health can be the unifier and the facilitator and not necessarily have to step on the excellent work that all the practitioners have provided in their unique centers over the past several years. Any other questions?
We're out of time.
Well, thank you very much for your time and attention. It was a great privilege for me, and I hope you all have a good day.